If you've hurt your back before and you have back pain or sciatica and you're becoming afraid of doing certain activities and it's starting to limit your life, limit your ability to do the things that you love to do, that fear is actually more disabling than pain itself, especially for long-term outcomes. So we really have to overcome fear, but it's really tricky because you might have very valid experiences where you have hurt yourself doing those activities. So it's perfectly natural that you would want to avoid those things. But the fact still remains we have to get over that fear, but then we have to balance that with doing it safely. So it's a tricky situation to be in. In this episode, we're going to talk about this. I'm joined by Dr. Blake, who helps out behind the scenes in our Beyond Back Pain program, and we're going to talk about the knowledge that you need, a lot of myth busting, because there's a lot of fear-based beliefs that a lot of people have around back pain, sciatica, around the discs, and they end up thinking that their spines are fragile. We'll talk about that. We'll talk about why you need safe pain protocols, clear guidelines around what type of symptoms are safe to push through, because there is such a thing as safe pain. And then how we can get the nervous system on board, because the trouble is that if we don't believe it's safe, then our muscles are going to spasm and prevent us from doing the things that we want. And then it's going to feel like a self-fulfilling prophecy. And then we'll talk about exercise and how we can use exercise even when you don't feel like any exercise is safe whatsoever. And we've had people who refuse to do something as simple as a cat-cow because they think they're going to have a major, like a disc herniation from doing a cat-cow, which is basically impossible because your discs are just too strong for that type of thing. And we'll try to give you some examples throughout the way. So, Blake, fear is a big one. Blake helps out a lot behind the scenes with, our chat support and client program design in the Beyond Back Pain program. So how do you see, like when we have somebody who's new and, they've had a lot of injuries, right? They've hurt themselves bending, picking things up. We've had people that it's like, I hurt myself just trying to put on my shoes, just trying to put on my socks, out of nowhere, or picking up a pencil,
Yeah.
How does that happen? Because I think a lot of people think that it's because I put on my shoes and I must have herniated my disc. I think first of all, we should talk about like what might actually be happening in those situations, because that's sort of the knowledge component. And I think what's actually happening is maybe less scary than people think. So if somebody just hurt themselves and they're really afraid to move because they've had these previous experiences, what would you tell them?
Yeah. The first thing I would tell them is to take a deep breath and try to calm themselves down, because a lot of times we work ourselves up and get really afraid, understandably, because pain sucks, right? And it's kind of scary. But when we get really fearful, it makes things worse, because ultimately pain is your brain's alarm system. Kind of it produces pain when there is tissue damage or there's potential tissue damage. So there's not necessarily always something wrong. It's just trying to predict that there could be. So it's trying to protect you. Like pain is your nervous system trying to protect you.
I just want to add to your definition too, because I think
Yep.
it's really helpful for people to understand that pain is not a sensation. That sounds really weird, but pain is
Mhm.
not a sensation. So senses are things that are like sensations are electrical impulses carried from nerves to the brain, right? Those are our senses. But then once it becomes a conscious experience, well, then it's an experience. But really, instead of thinking of a sensation, what we want to think of pain is not a sensation, it's a behavior. Pain is a behavior. It's an
Yeah.
output. And we have tons of research that points this way. And if you want the research and citations, we've made an entire pain neuroscience miniseries. So just send me a message on DM or DM me on Instagram and I'll send you the link to that video. But pain is a behavior, right? So part of the alarm system is pain, but it's also you change your behavior in reaction to the perceived threat,
Yep.
which means avoiding activity, tensing your muscles. Muscle spasms are a big part of that. And I think this is really important for people to understand that if you have a sudden flare up of pain, unless you had a major injury, it's unlikely that you've literally herniated a disc in
Yeah.
a single, like putting on your shoes. The chances of you herniating a disc, putting on your shoes, is not zero, but it's really, really low.
Yep.
So if you have pain suddenly, even if that pain suddenly shoots down your leg into your toes, like classic sciatica, that's disc, right? Not necessarily,
Yeah.
right? Could it be
Yep.
sensitive? Sure. More likely, could muscles be spasming? Probably more likely,
Yeah.
right?
For sure.
So it's hard to damage. What was your impression in school when we did? Because we did cadaveric dissection, and we had to. You remember when we did
Yep.
like spinal dissection? Like we literally sawed spines in half.
Yeah.
You know, it was wild, wild
Mhm.
experience. What would you? How would you describe the material of a spinal disc? Would you describe it like fragile or?
Leading question. Uh, well, it's definitely not a jelly donut, right? That's the one that I can't believe I saw a video from a pretty big content creator that I'm not going to say their name, but they literally had a jelly donut between like
Yeah.
their spine model. I can't, and we still use this analogy, and it's harmful because those discs are crazy strong. Like you could not, not that we did this, but like you can't pull it apart. Like if you try to like grab a dissected spine and like break the disc, I don't think you could do it. And
It'd
I
be
mean,
really hard. I
yeah,
think even if I took a real human spine and tried to break it over my knee
yeah,
like a log or something like that, I think you'd have a pretty hard time doing that.
yeah,
I'm not saying it'd be
I agree.
impossible. I'm sure you could, especially in the upper spine. But
Yeah,
in the low back, trying to actually like break open the disc, you would probably fracture the lamina before
yeah,
you would like literally rip open a disc.
yeah,
You'd
the
probably
bone.
have, I want to repeat that. You'd probably have a bone fracture before you actually like ripped open a disc. If you were literally had a human spine
Yep,
in your hands and you were trying to break it over your knee like you were breaking a log or something.
yeah. Discs are really strong, and that kind of lends to one of the things that adds a lot of fear to people's pain experience is we've just got all these myths about like your discs being really fragile or arthritis or this or that, and people get really scared, which is understandable because there's like big scary words, and the MRI, you get your MRI and somebody with lots of letters behind their name says, yeah, you've got the spine of a 90-year-old, which is just
Yeah.
a weird thing to tell
What
somebody.
a like what a
Like,
dick. I mean, like
yeah,
how why would you even say that to somebody?
I don't know. I have no idea. It
I mean,
blows.
literally, unless you're, I'm serious about that. Like, on what justification would you have to scare somebody so bad? Let's say a 30-year-old walks in and you're telling them they have the spine of a 90-year-old, or oh my God, that's the worst spine I've ever seen, or
Yeah,
oh my God, how are you even walking? You know,
yeah,
like the only case that I would ever say, look at a person's spine and say, oh my God, how are you even walking, is actually the first radiology case we ever
yeah,
had in our in school. Dr. Major pulled out this image, and he was like, "How do you think this person came into our clinic?" And it was an image of a grade 5 spondylolisthesis, which means
yeah,
we talk about bones going out of place. Bones don't go out of place. Blake, show.
yeah. So
Sorry for the
it'd be
podcast
like if
people.
the two vertebrae are sitting on top of each other. A grade 5 would be like it's off,
Well, and this one was actually
right?
hanging off. It was
Yeah,
not just off center and like
yeah,
off. It was literally like it
like fell
fell
off.
off. It completely
Yeah,
fell off. So you want to talk about joints being out of place? That is like the only case that I've ever seen where a joint is literally in the wrong place, and
yep,
that's that. In that case, I might even say, "Holy shit, how are you walking?" Like you probably need to get to like ortho now and have an evaluation
yeah,
because that's scary.
yeah. And you should go and
Yeah,
get
if
good
I
help.
ever saw a patient where I saw an X-ray and they had a grade 5 spondy, I would immediately, I wouldn't even send them to the ER. I would have the ambulance come because
Yeah,
that's genuinely a problem.
yeah,
But like, I just want to emphasize here, the only case that we're saying that would be that scary is if your entire spine was literally broken and dislocated completely.
yep. And that, I mean, the
That
odds
almost never happens.
are so low. Right? But we freak people out, and and the MRI report has all these big scary words in it, and they just send it to patients in like an email or a patient portal, and they're like, it says something like radiology,
Yep.
degenerative disc disease, blah, 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 blah. And you could replace degenerative disc disease with normal age related changes.
Yep.
And that would be a true sentence.
Yep.
That's just what spines do over time. Just like you get wrinkles in your face or, like more spots on your skin, et
Yep.
cetera, et cetera. Like,
So there's a lot. I think the main point, because we have so many videos debunking these fear-based myths. So part of it is knowledge, but the trouble is that a lot of people, that's not enough. You can tell them that their spine is not fragile, but it feels fragile.
yep.
And there's no amount of facts or research in the world that's going to overpower a person's lived experience of saying, that's great, but every time I even bend over or I cough or I sneeze or I put on my shoes, I can't get out of a chair. I can't get up and down. Like I can't do these things. It is too painful. So you can't tell me that that type of pain is safe. There's not going to be any convincing around that. So how do we address that?
You got to give people positive experiences with movement and slowly like gradually introduce more and more movement. It's just like when you go to like preschool. It is not like your first schooling experience is sitting in a desk for 8 hours listening to somebody like lecture on algebra. Okay, you like learn a little bit and then you go like play and you color and you do some fun stuff and hopefully give people a positive experience with school. Same thing with pain. And we gotta find an activity, any activity that isn't painful or that is lower pain, maybe like a 1 or a 2 out of 10.
Yeah, because you got to understand a lot of people are, well, there is no activity that's not
Yeah,
painful.
exactly. But we got to find something that feels safe, something that the person is comfortable doing. Do that for a little while and prove to yourself that you can do something safely, some movement, whether that's like a twist or a bend or just breathing into your core. Um, prove that that can be safe, and then we just make it a little bit harder, and then a little bit harder, and a little bit harder, and you just take small steps until eventually you're doing, whatever you want to do, golf or pickleball or lifting heavy weights or
Yeah. So then how do we get into bending and all those activities that we're afraid of? Because we can't start with those because people are too freaked out, right? And what if we say, okay, cool, we got to bend the spine. It's safe to bend the spine, and somebody goes to bend the spine and the back locks up on them. Then like how do we manage that? How do we actually give them that positive experience with movement? How do we know what's safe, what's not safe? How do we know what exercises to start with? How do we actually get the body to like allow you to do those movements?
yeah, you just start with really easy variations. So like let's say somebody hurt their back like bending over to touch their toes, or actually here's a better one, someone hurt their back like bending over and picking up something like 40 pounds. Well, obviously now we're not going to go pick up 40 pounds. We're not even just going to bend over and touch your toes because that's still too hard. We're going to like have you get into maybe a cat cow position where you're on all fours and just bend your back like a degree, just like a little bit of rounding, like a tiny bit.
Yeah,
And
like
do
so
that.
little you might not even see it if you were watching you. Like
Yep.
imperceptibly small.
Or if that's scary, maybe just slouch a tiny bit while you're sitting.
Or
Like,
laying on your back, hug your, grab a strap, a strap around your knees, and gently pull the knees towards the chest, but not all the way. So
yep.
and that's just a gentle rocking of the pelvis. Or even have somebody, if you live with somebody who can help you, they can even do the same thing where they're moving your knees back and forth, not all the way to the chest, not being forceful, but just allowing the pelvis to relax. So this
Yeah.
is one thing I really want to touch on is the fact that when we are in fight or flight, our muscles are going to tense up. A lot of people have a hard time understanding the connection between stress and pain, and there are a lot of neurophysiological reasons, meaning like your neurotransmitters and inflammation and your immune immune system and your autonomic nervous system become hypersensitive, right? So there's a
Yeah.
lot of reasons there. Like your alarm system is poorly calibrated and it sends off a lot of false alarms,
Yep.
hypersensitivity. That's one reason. But for that, for most people, well, most people that we work with, by the time they actually work with us, understand that and they get that. But it's hard for people to understand, I think, the connection between stress and pain sometimes. So let me make it very real. If you're stressed, your muscles are going to be protective. Your body's
Yep.
trying to tense up and be protective, right? Because you're afraid. You're afraid you're going to
Yep.
hurt yourself. When your muscles spasm, especially if you've been doing this for a while, you've been in pain for a long time, you're avoiding activity. So now your muscles are not strong or they don't have good endurance, right? Because you don't use them in a full range of motion often or ever. Now,
Mhm.
as soon as you do have to lengthen the muscle to do some activity, it's literally a reflex. It's literally your muscle spindle reflex, right? It's basically same reflex when you go to the doctor and they hit your patellar tendon and your quadriceps contracts and you kick, right? They hit you with the hammer and you kick involuntarily. Same reflex that can happen in your spine with the muscles of your back. If you never lengthen your back and then suddenly, oh, I just had to pick up a pencil real quick, right? Well, the muscle spindle reflex is when you quickly stretch a muscle. It's not
Yep.
dangerous. It's just your muscle spindle reflex is so sensitive because it never, ever, ever gets activated by stretching at all.
Yep.
You never move your spine. And so then suddenly your back cramps up on you and you
Yep.
think it's the end of the world, but it's like, it's just a Charlie horse, you
Yeah.
know? So
It's a
we've got
cramp like anything else.
I was just going to say, just to put a pin on my point here, is like you've got to overcome the stress part of it, which is why a lot of times, especially in early rehab, we can't just give the exercise because a lot of you listening have tried exercise programs, right? And you've tried gentle exercises, and they don't really go anywhere. And that's part of the problem with physical therapy is that it never goes anywhere. You never get stronger. You just kind of endlessly do core stability and stretching forever, and you never get strong. And they tell you never to move your spine, right? You got to brace your spine. Then the other side of that is some of you have done programs that are just stress relief, right? And that's it. But you're not backing it up with movement, right? You're just doing breathing exercises and journaling and, like working through your feelings and therapy, even, which are all good things. These are all good things, but you need to back that. You got to combine them, right? And so in early rehab, we always start people off with movements and stress relief at the same time, right? So we're trying to do a thing that you maybe haven't done for a little while, and we're trying to just calm your nervous system with breathing or with self massage or some other way to get your body to feel safe, like you're not in a fight or flight state, and then turn off your reflexive overprotective muscle spasms basically, and then you can have what Blake was talking about, the positive experience with movement, because we're getting your muscles to stop being overprotective by combining the stress relief with the movement and double dipping.
Yeah. It's really not rocket science. It's kind of it's interesting how there are there are programs like you said that focus on stress relief. There are programs that focus on core stability, which is fine. There's programs that focus on spinal mobility, which is fine. But like for whatever reason, people don't want to like put it all together
It's
usually.
so weird to me,
It's
like I
like we they I don't know why. I think as humans we like to like hyper focus on one thing.
oh yeah, yeah,
Like one thing is the answer. This one trick.
yeah,
But all the things help. Right? And you just gotta, live a balance. Like a healthy life is a balanced life. A
yep.
good rehab program is balance. It's got a lot of different stuff going on.
Yeah, I think again, it's like I think what it is we all get into our specialized training, and then we get some kind of niche interest, and then
Yeah.
you do a million certifications and trainings on that one niche interest. You get obsessed with fascia, and then everything's a fascia problem. You get obsessed with joint alignment, everything's a
Yep.
joint alignment problem. You get obsessed with stress relief, and then cognitive behavioral therapy is the solution to everything.
Yep.
And there's nothing wrong with any of these things, right? Even we, like as much as we talk talk about the fact that joint alignment and fascia and posture and asymmetries do not matter. It's not that they don't ever matter at all for anybody at any stage of rehab. It's just that the amount to which they matter in general for most people is basically not at all. But
Yep.
once in a while, when we have people who are struggling with, plateauing at a certain level of exercise, or maybe they're doing great with our progressions with exercise, and then they hit one exercise that they're like, I just cannot do the hip hinge without my back hurting. Now, sure, we can help cue you through it and get you to use, oh my God, more gluteal engagement. Go figure,
Yeah.
right? So we're not against those things at all. And for the right person, it can help. But overthinking is just as bad. Actually, we were just on our group call today, and one of our clients brought that up. The overthinking is what
Mhm.
makes it worse, right? The thinking too much about her form and technique during exercise makes it worse. So
Yep.
there's this happy medium where we're aware of what we're doing, but instead of being aware, let me put it this way: instead of hyperfixating on form and technique, which is going to make you more protective, more guarded, more likely to have muscle spasms, versus using intention on the breath, right? Use
Yep.
intention on how like peaceful can I be while I do this gentle, especially in the early stages of rehab, right? Later on, when we're doing real strength and conditioning and athleticism, absolutely, there's we want to put it all in into the physicality of it, but especially early on, putting the intention on the relaxation and being at peace with your experiences and being more mindful with the movement is just a better, I think, a better, like it's going to create more aha moments for
Yep.
people.
Yeah. And I think to kind of tie into you were talking about all these things that they might help a little bit in some situations. Those are all like side dishes or spices or whatever you can add to your food. But like the main thing is you need to deal with your stress and fear. And you got to do some kind of movement because you got to prepare your body to move in life.
Yeah.
It, so you got to feel safe, figure out a way to feel safe. And that includes, dispelling some common myths that you might believe that are fear inducing, like that your disc is a jelly donut or something like that.
Yeah.
You
And,
know,
and again, for the record, your discs, if you wanted to describe the material, I would describe it as a car tire filled with chewing gum,
yeah, like old hard.
old chewing gum.
Yeah.
They're tough.
Yeah.
They're like
So you got to
rubbery.
just, yeah. So you got to dispel myths like that, which is important. And then you got to work on stress to like calm down. And that might be meditation. That might be calling your mom more often to, talk, or your friends, or that might be doing more activities you enjoy. I mean, we've had clients that their big aha moment was, oh, I feel so much worse when I'm at home all day by myself. But if I go out and spend time with people that I care about, my
Hmm.
pain goes from like an 8 to like a 3.
Yeah. Or we've had the opposite where when they're around certain people that
Mhm.
are sources of stress for them, like maybe they have a poor relationship with a family member or a spouse or an extended family member or something like that. The in-laws, that's kind of a classic example.
Yep.
But it's something like that, right? Where if there's a person in your life that, especially if you can't avoid them because they are
Yeah.
family and they are a source of toxicity and stress or maybe even previous trauma, and people notice, oh, when I'm around that person, my pain goes bananas.
Yep.
So like, okay, well, now our rehab, and I think this is really the point, like that people completely miss. Everybody wants a very specific, like, well, just do this, then do this, then do this.
Yeah.
And it's
Yeah.
all got to fit into nice, neat little buckets. But the reality is, if you have, again, just to try to use a dramatic example to prove a point, like if somebody had childhood trauma from a family member and still for some reason had to see that family member in
Yep.
real life, then all the bird dogs and dead bugs and even what we would do, which is actual graded exposure to full body exercise, and we would give breathing exercises and meditations and journaling prompts and whatever
Yep.
was necessary, cold exposure. There's a lot of ways to retrain your nervous system, but all the retraining, nervous system rewiring, and down regulation in the world, combined with all the exercise on the planet, is not going to get you out of pain if you don't set boundaries in your life with a person that is toxic
Yeah.
and that you have to see all the time. If you don't set those boundaries and do something better for your health and your situation, it's not going to work. Or like another example that's a little bit, probably more relatable to more people is like work, that it's like you're doing this to yourself. You're traumatizing yourself by
Yeah.
working 80 hours a week and making work your life and not hanging out with your kids and not getting the sleep that you need and sacrificing your health. And yeah, there's the downstream consequences of, oh, wait a minute. But Dr. Davis, you talk all the time about the four pillars, right? Rehab for back pain, sciatica, and any kind of chronic pain should be about exercise, mental health, nutrition, and sleep. Yes, but where is that coming from? Why are you getting shitty sleep? Why are you so stressed? Why are you eating like crap? Oh, it's because you work 80 hours. You don't have time for lunch. You don't have time to get home to sleep. You don't have time to socialize. You don't have time for your exercises. So
Yep.
I can't give you any exercises. I can't give you any stress relief activities if you continue to work yourself to death.
Yep.
So now your rehab is changing your work situation. I'm like, that sucks and nobody wants to do it, but that's the
Yep.
reality is that might be the single biggest thing that you could do for your rehab. At this point, we're not talking about fear of pain anymore, I realize, but
Well, you can
whatever.
loop it. Well, we can loop it back into like, I think all of this fits really nicely into feeling safe within yourself, your
Yeah.
body, your life, your whatever, and feeling at peace and safe and calm. Because if I was gonna like try to come up with one rule for like overcoming chronic pain, you need to figure out a way to feel safe.
Yeah.
Because a lot of times, cat, a lot of times, people can't sleep because they're stressed. They feel
Yeah.
on edge all the time. You eat crappy food because you're stressed. You feel on edge all the time. Your muscles tense up when you try to exercise because you don't feel safe. You know, so on and so forth. So what doesn't feel safe is going to look different for different people, right? Might be relationships for some people. It might be um, an eating disorder for other people. It might be insomnia for others, so on and so forth. It might be the kind of simple I deadlifted a really heavy weight and I felt a pop in my back, and now it's 5 years later and I'm still afraid to bend my spine. It might look different for everybody, but practically you got to kind of identify like what areas do I feel unsafe in? What areas am I scared of? Or what areas might be like increasing my stress, and you actually have to address those.
So, just to give some practical guidance for those of you listening or watching, if you're listening, just know we have this same stuff on YouTube. And if you're on YouTube, you can always listen to it as a podcast. But this is, I believe this is from Lorimer, Mosley, and Butler, the Dims and Sims, right? So, this
Yep.
is kind of out of our classic Explain Pain book, which is a good one for both practitioners and patients. But Dims and Sims, so danger in me and safety in me, right? So,
Yep.
we've got 7 categories. So, things that can make you feel safe or things that can make you feel like you're in danger. So, what we want to do is look at the totality of your life and find what those things are that make you feel in danger or make you feel safe. And then, obviously, do more of the things that make you feel safe and try to set boundaries around the things that make you feel in danger. So, examples, because I want to give you some practical takeaways here. So, 7 things, 7 categories. Number one is, and I'm reading this directly from Lorimer Mosley's worksheet. This is things you hear, see, taste, and touch and smell. Things you do, things you say, things you think and believe, places you go, people in your life, and things that are happening in your body. So, all of those categories, we could say that there are certain things in each category that might make you feel safe or unsafe, depending, right? If you tell yourself, I have a bad back, versus telling yourself, actually, my spine can regenerate through exercise and become tougher and stronger. Now, can you reverse arthritis? No, but can you delay the onset and can you make your spine healthier, even regardless of the arthritis? Can you still make your spine healthier? Yes. right? So if you tell yourself and remind yourself of those facts, things you do like taking pills and avoiding going outside versus engaging in gentle exercise or stress relief activities, etc. So there's a lot of different contexts there, or even the people or places in your life. If you're going to and some of it could be the same situation but slightly different, like going to a doctor that makes you feel broken versus having a healthcare provider or people in your corner to guide you on your rehab journey who are encouraging you and reminding you of how strong you are and how capable you are and giving you evidence-based encouragement like that. It makes a huge, huge difference. So more of the things that make you feel safe, less of the things that make you feel in danger. Is there anything else that people would want to know if they are trying to overcome the fear of pain? They get, all right, let's assume that they're like, all right, I understand that maybe my apprehension, maybe I am overprotective.
Mhm.
Is there anything else, but they're having a hard time implementing this stuff? Is there anything else that could help people understand how to actually overcome that fear that we didn't talk about?
So first off, you just general important thing is knowledge is great, but you do have to put it into practice. So you're going to have to do the hard thing. You might. So my recommendation to start off with would be to do that worksheet, the danger in me, safety in me, and identify what area is bothering you, right? What areas should be your main focus, and then it kind of depends upon from that point, right? So I don't know, maybe we want to pick an area
Yeah.
and go from there.
Well, I think that's we don't. I don't want to go into too much depth
Yeah.
due to time on this one, but yeah, I think that's a good place to start is understanding, trying to find the areas of your life that why are you feeling unsafe. But part of that is going to come back to exercise. I'm sure a lot of people are
Yep.
feeling fear of re-injuring themselves by doing exercise. And since exercise is such a huge part of rehab, it's tough to know when you're doing the right thing. One last thing I think I want to leave our listeners with is understanding that when you do try something, it is normal to not have every attempt go perfectly. So
Yeah.
if you try something and it gets extra sensitive, that could be viewed even as a good thing. So I'm going to
Yep.
repeat this. If you try, for example, you're saying, "Oh, I need to ease my way into bending," and so you try some cat cows and your back flares up, that is good. No, that's like that could be good news in the sense that it is information. Now you know that that exercise right now, in the
Yep.
way you performed it, is something that you're not quite ready for. So that means we have to find something that is easier. It does not mean that exercise is unsafe. It
No.
doesn't even mean that that exercise itself was unsafe. It just means that it was a little outside of your reach right now. So, like in our program, how often, right? I think this is half of our job inside of our program is just, how many people, what percentage of people do you think our program is 12 weeks. All right. So we give you guys a custom rehab program. We give you all the accountability and guidance on the planet. But how many people do you think go through in 12 weeks and never have any downs with any exercise? It's all progress all the time and they never have a bad day.
If
What
it's
percent?
not, yeah, if it's not 100%, it's very close to 100%.
Yeah. Or zero, the way I asked the question. But yeah,
Yeah, yeah.
yeah, yeah,
You get what I'm saying.
yeah. So nobody,
Yeah, no,
nobody,
nobody. It's
but
normal.
But our success rate in the program, so 86% of the people that go through our program are satisfied with the results at the end. If we only count the people who actually did what we tell them to do, then it's 98%. So 98% of the people that we work with by the end of the program, they've made really good strides and
Yep.
proved to themselves that what we are doing is absolutely working. So 98% get success. None of them None of them have a perfectly straight upward trajectory. And
Nope.
all like each day is better than the previous day. That doesn't happen.
No, it's up and down, right? Because you've got to try stuff. You've got to try new stuff. You've got to push yourself outside of your comfort zone a little bit, and ultimately, that's gonna cause some flare ups here or there.
So one of the biggest, I think one of the biggest reasons why, other than the fact that everything that we do is evidence-based and we give people tons of support, I think one of the reasons our program is so successful here is because of the fact that when people do have those bad days, we are there to remind them that these days are normal and
Yep.
to help them modify, not give up, but modify.
Yep.
Right? That's the key because no matter what type of journey you go on, no matter if you do our program, you do somebody else, you go to physical therapy, you do things on your own, you're going to have ups and downs. It's just really, really easy to give up when you have a down. Oh, well, I've tried everything. Have you? Okay, so I tried these exercises but then I had, a flare up, so it didn't work.
Yeah. That's
Well, did you try to modify what you were doing when you had the bad day? No, I just gave up because obviously it's not good for me. Well, that's not that it could just be the amount that you did. It could be the range of motion that you did. It
yep.
could not even be any of those individual exercises, but the totality of all the individual exercises that you did in a particular workout. So maybe the workout had 10 different exercises
Yeah.
and they were all fine individually, but you can't handle doing all 10 at once. Or you couldn't handle doing the workout in itself as a condensed workout, and all you needed to do was do the same workout spread out throughout the day, right?
Yep.
Or just do one set of everything and spread that out throughout the day. So the idea is that, oh, I did the thing and it flared me up and therefore it's bad, it's dangerous, I'm afraid, I can't do it. That is so easy to give into that fear. And there are
Yep.
so many ways to modify, like all the things that I just mentioned. So there are a million ways that we can work around fear. To summarize here, it starts with knowledge and understanding that your discs are strong, your spine is strong, your alignment and posture and asymmetries usually don't matter at all, or if they do, it's not worth worrying about. What's more important is gradual exposure to full body exercise, stress reduction so that your body's not in a fight or flight state and prone to spasming because of reflexive muscle guarding, gradual exercise that proves that you're safe, especially doing exercise that you enjoy because
Mhm.
it's naturally going to make you feel safe, and then building that and proving it to yourself and building the confidence slowly and being patient. And then lastly, understanding that you are going to have good days and bad days, and that bad days are nothing more than a learning experience to say, how, okay, this is a cue that something that I'm doing just needs to be modified. That's it,
Yep.
just modified. As long as you're following all the other advice of gradual exposure to full body exercise and then taking care of stress, sleep, and nutrition, then you're going to be fine. So take it easy, one step at a time. And if you want help and if you want to stop having the, ups and downs and freakouts and not knowing what's a normal flare up versus something you got to modify, what's safe pain versus unsafe pain, how do we progress exercises, how do we regress and modify. If all that stuff is just a freaking headache and you want to know what to do each day and have accountability and support, our program, obviously, we think very highly of it, but just reach out to us. Watch the masterclass. It's always in the description of our videos. And then you can also send a DM on Instagram. Feel free to just send me a message. I'm happy to get to know you and see what's going on. But either way, you can either watch the masterclass, send me a message, and then happy to talk about your situation and see if you're a good fit for what we do and see if we can help get you back to an active life. So that's it for today, and we will see you in the next episode.